Good morning, my professors, my consultants, my colleagues, senior colleagues and my colleagues, other health workers that are here present, medical students, ladies and gentlemen. I welcome you all to this gathering this morning. We are very happy that you could make out the time to be here. This program, the first health summit, is actually conceived. The idea for it was conceived by C-HELP. C-HELP is an acronym for Center for Health Education and Life Promotion. It is an organization that is passionate about saving lives via running of free clinics in rural communities, provision of prosthetics for amputees, provision of cancer treatment support for patients living with cancer, empowerment of the girl child, and enlightenment campaign. Even though the idea was conceived by C-HELP, being a reality today was actually made possible because a number of other organizations came forward to share the dream and make it possible today. Top on the list of those partners is the Medical Women's Association of Nigeria, M1, ably led by our dear Dr. Mrs. H.M. Madugu, who also is the director of the ABU Medical Health Center. We are very proud of the leadership that she has been providing, and we say that the Lord will continue to bless her and help her to do more. Other supporters of this summit are the the Waziri Foundation. We also have Coriander Resources Limited, and of course the Association of Resident Doctors, ABU chapter. They've all been very supportive in putting this occasion together. My job this morning is very simple. I am here to set the tone for this meeting, and I'll briefly take you through the reason why this summit needs to hold. My name is Dr. POPOOLA Margaret, and I'll be doing it through this outline. Introduction, I'll be doing it through this outline. A brief introduction, what the ideal health system should be like, the Nigeria health system, what is it like, the challenges that the Nigeria system currently faces, and then the way forward. The theme for this program is called Restructuring the Nigeria Health System. It is self-explanatory. It simply means that the Nigeria health system is bedeviled with many problems and is in need of restructuring. I believe we all agree with that. It was Chinua Achebe, the author of the famous book, Things Fall Apart, who wrote, and I quote, "Things fall apart, the center cannot hold, mere anarchy is loose upon the earth." It aptly describes the state of Nigeria health system today. Despite many efforts by the stakeholders of health, things just don't go well as planned in the health sector. What is the ideal health system? Personally, or in my opinion, the ideal health system is that health system where the needs of both the patient and the caregiver are adequately provided for within or by a government that provides great policy directions, that drives growth, that drives medical, technological, and economical growth. We can say that to achieve the ideal health system may not be possible in many climes, but there are nations, particularly in the developed world, that are striving towards achieving the ideal health system. Many of you here have gone to so many of such places, and you have been able to see firsthand what obtains in such places. Even if they don't get it 100%, they keep striving to get close to it. So our discussants today will be telling us some of the things they have seen out there that are lacking in our health system. What is the state of the Nigerian health system today? One of the things that characterizes the Nigerian health system today is lack of adequate data. That can be found in almost every aspect of our practice. And it simply shows something. It shows that we are not a nation that is inclined to research. And research drives development. But unfortunately, our nation is not inclined to research. And it is evident in different aspects of our health care, as shown by declining indices across board. Under immunizations, indices are poor. Maternal mortality keeps rising by the day. The Millennium Development Goals that we set with so much enthusiasm up till now have not been fully realized. Instead, we keep pushing the goalpost. Life expectancy keeps decreasing. There is a gloomy cancer epidemiology. And of course, medical tourism is the order of the day. We love that aspect of medicine. Unfortunately, we are not using medical tourism to our advantage. So many nations of the world, to use a few examples like India, China, they thrive on the population that they have. India, for instance, thrives on its large population in making use of medical tourism to bring needed resources to their country. China, on the other hand, uses their large number to drive technology to bring much needed revenue to their country. However, in Nigeria, the most populous black nation in the world, we are so proud of it, yet we don't know how to harness this large population for our own benefit. I want to encourage us today that it is possible for us to use medical tourism for our own advantage, and the people that can drive that is the people in the health sector. We are using medical tourism, but in a negative way. We are going outside, taking our hard-earned currency to enrich other countries. We cannot say that other sectors in Nigeria are not taking advantage of the population. No, we cannot say that, because other less important, if I may say so in quote, industries are taking advantage of the nation's population. Take for instance the garment industry, that's the fashion industry, the music industry, the film industry, Nollywood. They've all taken advantage of the large population of the nation. They have grown their industry to tremendous heights. They have put Nigeria on the world map with their craft. But in medicine, we have not been able to do that. And I don't believe that it's because we don't have the people that can make it happen. We actually have, but somehow we have not been able to do it. Having said all this, what is the way forward? While we cannot boast of restructuring the whole health system in a day, we can actually decide to start from somewhere and to start small. Our favorite slogan in See Help is doing little things with great love. I believe that if we start small and start somewhere, we can get to someplace big sometime soon. And that takes us to the sub-theme of the program today. That was why the sub-theme for the program was chosen to be cancer treatment in Nigeria, the way forward. Even if we cannot start by restructuring the whole health system, we can take cancer and start from there and see where we can get to. Most importantly, by way of conclusion, I would like to thank all of you for gathering here this morning, and I will use this opportunity to invite those people that are going to discuss this topic with us today. I'm going to invite each and every one of them. As you come up here, you take 1 minute and tell us a little of what you think of the health system, or of what you think you can do for the health system, or just tell us something. Most of you seated here have seen the world. You have seen the development in other climes. Allow us today to see with your eyes what you have seen. Some of you here are innovators in your small corner where you are. Allow us to learn to innovate from you. Some people here have touched many lives despite having great personal difficulties and pain. Allow us to learn to love through the pain that you have felt. Thank you very much. Permit me to call in no particular order this morning to the podium this morning, where our discussants will take up the discussion. I would like to call in no particular order. I'll call on Dr. Ahmed Mohammed.